So, you know, insurance companies have created like averages for how long dentistry lasts, and on average, restorations, whether it's a filling or a crown, tend to last. And this is an average, mind you. Throwing good dentistry, bad dentistry, good lab work, bad lab work together, and coming up with a number, and it's 5 to 7 years. So typically, tooth decay starts when we're kids. So you get teeth when you're 6 or 8 years old, and pretty soon after that, you start getting cavities. Put fillings in them. Nothing we make, again, lasts forever. So eventually you're going to get what we call recurrent decay around an existing filling. Once you get beyond the age of 18, 19, 20 years old, we start taking care of our teeth better. You don't typically begin to develop new decay beyond that age. But what you're left with is maintenance of the stuff that you had done for you when you were a kid. And what happens is you get a cavity around a filling, you get a cavity underneath the crown. We call that recurrent decay. And when that happens, we need to take out whatever's in your tooth, remove it, remove whatever decay has developed, replace it with a new restoration. Personally, I'm more proactive than reactive, and if I start to see decay, I just make it simple. It's black or white to me. Any decay is too much. The only thing that happens when you watch decay is it gets worse. And if it gets worse, the hole in your tooth gets bigger. The goal is to put off crowns as long as you possibly can, if not forever. And the way you do that is by being proactive with the dental care. If you see an issue, address it, take out the old, put in the new. And I think that in a good environment, with good hands, good labs, and good dentistry and good materials, things last a lot longer than 5 to 7 years. I have patients that I've been seeing for 17 years that still have veneers that I did when I was a new dentist. So I think things can last a long time if done properly. Don't be scared of the 5 to 7 years things, but realize that whatever we do for you isn't going to last forever. That's why 6-month cleaning appointments are real important, and your yearly dental exam, so that if we see something occurring, we catch it early and we transition to whatever the newer thing is as quick as we can and help prevent extensive decay from developing.